back with another video lecture, and today we are going to discuss the jersey finger. Basically, jersey finger is a basic disruption, or you can say disruption in the flexor digitorum profundus tendon. The main tendon that is present in, on the, you can say, on the interior side, or you can say on the palmar side of the hand. So start from the basic mechanism of the injury. They start from the very first, that is commonly occurs when an athlete's finger catches on another player's clothing while playing a team sport such as rugby or football. Athlete pulls away, the finger is forcibly straightened while profundus flexor tendon continues to contract. If you can say from the very first that if a person's finger, you can say in a flexion position, right? So if you can say a person's finger is in a flexion position during any during any sport, like mainly in the football or rugby, that is also called as rugby finger. Rugby is basically, or you can say in a football, if a person's finger is if a person's fingers, you can say like this, catches, or you can say catches, or you can say if in contact with an other person's clothing, and a person, you can say if we want to remove, or if we want to move away our finger, or you can say release our finger from the clothing, the finger is forcefully straightened. That causes the forcibly straighten of the finger because of the maybe you can say in other ways, the person's clothing has been stretched. So you can say if the cloths have been stretched on the other way, so you can say that if a person can remove, or you can say release his clothes from your finger, so that is also causes the straighten of your finger. That is basically the main area of the disruption of the flexor digitorum profundus tendon. Most commonly injured finger is a ring finger because of its weakest nature. That you can say, if in a single way, if in a easiest way, you can say the mainly finger that is involved is a ring finger because of its weakest nature. And mostly the 75% of the all you can say in all fingers, 75% of the cases that we have faced in our clinic, the main, you can say, the involved finger is a ring finger. Now next one is the sign and symptoms of the finger, or you can say the sign and symptoms of the jersey finger. Pain and swelling at the volar aspect of the DIP joint. That means the pain and swelling in the ring finger on the interior side, or you can say on the palmar side, at the DIP joint. So that means this area is basically involved in the pain and swelling. Patient is unable to bend because the finger is already straightened, so you can unable to bend your finger, affected finger. Tenderness felt elsewhere along the finger or hand if profundus tendon is retracted. That means if the profundus tendon, of course, there is the profundus tendon, but the muscle of the profundus, or you can say flexor profundus, that can crosses your wrist joint and come from the forearms. That means the whole root is involved in the tenderness part. The whole root is involved in the tenderness part. Next one is diagnostic. Diagnostic test is basically in a single way holding the affected finger of MCP and PIP joint in extension. You can hold this finger in a extension, and on the other hand, while rest of the finger remain in flexion. Of course, if you can place this finger in a flexion and you want to perform DIP, you can say on a DIP joint flexion. So if the test is positive, the DIP does not move, that means the DIP does not perform a bending. That means that the DIP, or you can say the main flexor digitorum profundus tendon is ruptured, because that causes the concentric contraction of the DIP joint. So if a very single or if a very detailed way, we can say this is the MCP joint, that is metacarpophalangeal joint, that is PIP joint, that is proximal interphalangeal joint, and that is DIP joint, that is distal interphalangeal joint. This is the main area that involves in the disruption of, okay, this causes that DIP joint, or you can say that flexor digitorum profundus tendon is ruptured in this area, that causes the straightening of your finger. Now the main management protocol is basically, you can say, the diagnostic imaging for any eversion fractures, confirm the suspected jersey finger, and if that needs a medical intervention, you can also refer a patient to a medical consultation. In a very acute stage, you also perform the icing. Then after that, you can follow up the protocol like that. If the patient needs a surgery, you can refer the patient to the medical specialist or the surgeon. Then after that, if patient needs passive range of motion exercises, place and hold exercises, strengthening exercises, that is putty exercises on handball therapy, and that also sometimes the patient also needs the splints, that is dorsal blocking splint, that can cause your finger or you can say the DIP joint in that can causes your DIP joint in a flexion position, and you can say that splint is used to help your finger remain in a flexion position. So this is the whole protocol you can follow. Start from the icing, then from the passive ROM, then from the strengthening, the basic protocol, and that leads splints, and at the end home plug. So that is the whole basic protocol, and we can discuss in a detail in another video if you want to need, or if you want a detailed lecture. Thanks for watching. This is the basic interview of jersey finger. If you have any queries, you can ask.